Hello and welcome to another Facebook Live broadcast with MedStar Health. My name is Karen Single and I'm joined today by cardiac electrophysiologist Dr. Aditya Saini. A cardiac electrophysiologist is a cardiologist that specializes in heart rhythm disorders. As you've been following us this entire month, we've been discussing various heart-related topics as it is Heart Month. And today we're discussing another very important topic, diagnosing an arrhythmia. So what is an arrhythmia, what causes them, and when should you see a doctor if you think you have one? We're going to answer those questions and more, so stick around, ask your questions, and share this video with your friends. Thank you so much for joining us today.
Thank you.
Before we get started in the discussion, would you share with our viewers a little bit about yourself and what got you into cardiac electrophysiology?
Well, as you mentioned, cardiac electrophysiology is basically the science of arrhythmias or electrical disorders of the heart. I'm a cardiologist who is a heart rhythm specialist, and I deal with basically the electrical problems of heart rhythm. Mm-hmm. And I was always excited to be a cardiologist, but within cardiology, during my training, I realized that I was most passionate about dealing with the electrical problems of the heart, and that's what drew me into cardiac electrophysiology.
Wonderful. Mm-hmm. Thank you. Okay, so let's get into the discussion. Let's just talk generally about arrhythmia. What does it mean?
So arrhythmia, in simplistic terms, means any abnormality of the heart rhythm. To be more specific, these abnormalities could be bradyarrhythmias or abnormal slowing of the heart rhythm, or tachyarrhythmias or abnormally fast heart rhythm problems. At the same time, there are other diseases such as extra heartbeats, which would also qualify as a heart rhythm problem or in the category of arrhythmias.
Okay, great, thank you. So what are the different types of arrhythmias?
Well, it's a very broad term. Mm-hmm. As we talked about, bradyarrhythmias or bradycardia is abnormal slowing of the heart rate and rhythm, and that would be one category. On the other side, there are tachyarrhythmias, in which we have abnormal fast heart rhythm problems coming from the top chambers of the heart, the most common one being atrial fibrillation, mm-hmm. or atrial flutter, atria standing for the top chamber of the heart, and fibrillation meaning quivering or fluttering of the heart. And they could be coming from the bottom chambers of the heart or the ventricles, which could be ventricular tachycardia most commonly, or ventricular fibrillation, which often result in cardiac arrest. And then there could be extra heartbeats, which are more commonly seen, and these extra heartbeats could be coming from the top chamber of the heart, known as premature atrial complexes, or bottom chambers of the heart, known as premature ventricular complexes.
Mm-hmm. Yeah. Okay, so what causes an arrhythmia?
Well, as it really depends upon the type of arrhythmia that we are looking at. Okay. Arrhythmia could present as a primary cardiac problem. That means the patient does not need to have any underlying cardiac issue to cause an arrhythmia, and the first time he or she presents with the arrhythmia to the clinic. Or it could be in the setting and as a result of other cardiac problems like heart failure, like coronary artery disease or blockages in the blood vessels of the heart, or heart attacks. And then, it is not only important to deal with the arrhythmia, but it might sometimes be more important to deal with the primary cardiac problem that was actually causing the arrhythmia. Mm-hmm. Mechanistically, arrhythmias can be due to an abnormally active focus or spot inside the heart muscle, or they could be due to a presence of a scar inside the heart muscle, which sort of provides a short circuit for initiation and maintenance of various heart rhythm problems. And those will be the most important reasons I can think of right now.
Great. So are certain people more at risk than others for an arrhythmia, and what are those risk factors?
Yes, again, that's a great question, and it depends upon the type of arrhythmia. Atrial fibrillation, which is one of the most common heart rhythm problems. Let's start with that, and sure. If you're talking about risk factors, at increasing age or advancing age is one of the most important risk factors. It's most commonly seen in the elderly population. Also, presence of heart diseases like hypertension, high blood pressure. or congestive heart failure or abnormal pumping of the heart muscle, presence of blockages in the blood vessels of the heart or coronary artery disease, or patients who have had a prior myocardial infarction or a heart attack would be most at risk of developing arrhythmias. Sometimes, however, as I said, arrhythmias can arise in patients without presence of or diagnosis of a previous heart problem. Genetic components are also very important in certain types of arrhythmias, and patients can have very dangerous heart rhythm problems coming from the bottom chambers of the heart, or essentially cardiac arrests, because of some ion channel problems inside the electrical wiring of their heart or the cells of their heart, which is basically a genetic issue, and that's a completely different category of heart rhythm problems.
Okay, thank you. What are some telltale symptoms for an arrhythmia?
Generally, symptoms of arrhythmias again are very broad, and patients can present, or even sometimes we diagnose them incidentally when we are checking them in office. They are noted to have extra heartbeats, or which they never knew about. However, they can be extremely severe symptoms in certain situations, as the patient can present with a cardiac arrest to the hospital. So extremely life-threatening situation. In the middle of this spectrum lie symptoms like palpitations, or abnormal feeling or awareness of a fast heartbeat, awareness of a slow heartbeat, awareness of an irregular heart rhythm, and also lightheadedness, especially in patients who have an extremely slow heart rhythm problem or an extremely fast heart rhythm problem. Patients can present with passing out, just pass out. They may feel tunneled vision and lightheaded, as we mentioned. If the heart rate is too fast, they can feel chest pain, just like they would feel in a situation like a heart attack. And essentially, those are the common symptoms. And as I said, many times patients won't even know that they are having a heart rhythm problem when they actually present to their primary care for just routine checkup.
Okay. So now that our viewers know the risk factors, they know the symptoms, if they think they have an arrhythmia, when should they be evaluated? If
patients know that they're having symptoms, as we talked about, of an arrhythmia, especially if they are having awareness of an abnormal increased heart rate or abnormally slow heart rhythm or irregularity or skipped beats or extra heartbeats, then they should immediately get checked.
Okay.
The first thing to do would be to see their primary care and start from there, as the primary care can then perform a extensive history and examination, just like any other heart problem or any other physical problem would require. And based on that, the primary care can perform further testing, which may include a simple electrocardiogram or an ECG, or further monitoring, which often requires a referral to a cardiologist. And this monitoring could vary between just a Holter monitor for 24 to 48 hours, and can go on to a wireless patch for 14 days, or even implantable small monitors, which we are doing a lot these days, for screening and assessing the burden of heart rhythm problems for a longer term duration, especially for atrial fibrillation.
Okay.
So yes, they should see their primary care, and often they would be ending up being referred to a cardiologist if the primary care feels that the problem is serious. And from there on, depending upon the results of the workup, if anything such as a procedure or advanced medical treatments like starting antiarrhythmics or doing procedures like ablations or electrophysiology studies are required, often the patients will see a doctor like myself, which is a cardiac electrophysiologist.
Okay. And once they see you, how would you diagnose them with an arrhythmia?
Yes. So as we talked about that, often when the patients come to me, they've had some form of monitoring already done. Many times we know we have sort of narrowed down the differential to a particular category of heart rhythm problem that the patient might be having. Depending upon what that category is, we would proceed with further workup. As I said, that may involve just watchful waiting, taking or adjusting the medications that the patient is on, because sometimes medications can abnormally slow your heart rhythm. Sometimes adding some medications and just waiting and seeing how the patient does on those medications. And at other times, we need further investigations like implanting the monitors that I was talking to you about. And sometimes we need to do invasive studies, which are known as electrophysiological studies, in which we put up catheters in a minimally invasive technique through the groin, veins, and arteries into the heart of the patient, and actually place these catheters in specific locations in the heart and sort of pace and do a full diagnostic study to try to induce or put the patient into that heart rhythm problem and exactly define where it is coming from and what is the mechanism of this problem. And based on that, during the same procedure, we can actually perform a more definitive solution for this problem, which is often known as an ablation. And sometimes for slow heart rhythm problems, what we need to do is consider implanting pacemakers. For cardiac arrest patients, we need to consider implanting defibrillators or devices to protect them from sudden cardiac death, because these patients continue to remain at risk of a recurrent event often.
Okay, thank you. So once you've been diagnosed with an arrhythmia, you might have mentioned a couple just now, but what are the treatment options?
Treatment options are non-invasive or invasive. Non-invasively, to treat an arrhythmia, we often use medications known as antiarrhythmics. And there are various categories and strengths of antiarrhythmics. They work well depending upon the type of the arrhythmia we are dealing with. In treatment of some arrhythmias like atrial fibrillation and ventricular tachycardia, often we would resort to antiarrhythmics before we go and do any procedures. For other problems like supraventricular tachycardias or more common regular tachycardias that come from the top chambers of the heart, often the best and the most definitive solution is doing an ablation first, because that is often curative in these patients. On the other hand, for atrial fibrillation and ventricular tachycardia, if antiarrhythmics fail, we have to resort to more complex invasive procedures. Again, these are invasive, but they are minimally invasive and pretty common these days to resort to an ablation procedure for atrial fibrillation, and even for ventricular tachycardia for that matter. And more we are resorting to these options these days for many of our patients.
Thank you. Do all arrhythmias need to be treated?
Good question. No, all arrhythmias do not need to be treated. Any arrhythmia which is symptomatic, it definitely patient presents to you with some symptoms, which could again range from just being a nuisance problem to a very severe disturbance in their quality of life. Yes, they would need to be treated either with medications or with procedures, depending upon the type of arrhythmia we're dealing with. But there are certain situations in which if the patient has having, say, extra heartbeats or coming from the top chambers of the heart or bottom chambers of the heart, we do not necessarily need to treat them as long as the patient is symptomatic. Many times patients are not symptomatic and we don't really need to go after them. And just a touch of a small dose of medication can sometimes take care of the problem, and sometimes we don't even need that. In cases of extra heartbeats, if they're happening very frequently, or if the patient is feeling each one of them, or if it is affecting the patient's heart function, that would be a reason to do something about it. But many times we just leave them alone if they're not causing any of these problems to the patient.
Okay, thank you. We do have a question from Connie. Thank you, Connie, for submitting your question. She said, I have severe tricuspid regurgitation, and I've had open heart surgery, which I cannot have again. Is there a non-invasive way that I can have my tricuspid repaired, and who should do it?
Well, this is a little side from our topic that we are talking about. Tricuspid is basically a valve of the heart on the right side of the heart. And tricuspid regurgitation essentially means leaking from the heart valve. Now again, if the leaking is the primary problem, if the valve is the primary problem, it has to be repaired or replaced. Most of the times this situation would require a surgical procedure, especially for this particular valve. But many times this problem of tricuspid regurgitation is not the primary problem. It is a result of left side of the heart problems or of lung diseases, or the chamber of the on the right side of the heart may be dilated, and that's what is causing the tricuspid regurgitation. So yes, it is not an electrophysiological problem, but however, she needs to make sure she sees a cardiologist, and then probably is going to be referred to a cardiologist who further subspecializes in structural heart problems, or a surgeon to deal with these problems, specifically with this tricuspid regurgitation. But yes, it does not usually is an issue for an electrophysiologist to deal with.
Okay, well, thank you for answering that question. So let's go back to arrhythmias specifically. Can arrhythmias cause or worsen other conditions?
Arrhythmias can cause and worsen other conditions. If a patient's heart is all the time beating at more than 100 beats a minute, or completely irregularly and erratically and rapidly, you can imagine that the heart doesn't get enough time to relax. And so if this keeps on happening days and days, the patient can develop heart failure, which is known as tachycardia-induced cardiomyopathy, which is basically heart failure induced by an abnormally rapid heart rhythm. So in that case, we have to be sort of try to find definitive treatments for the heart rhythm problem, because not only is the heart rhythm problem important, but it is important that we make sure that the patient's heart does not become weak, because that's essentially a big challenge in the future for such patients themselves. So treating the heart rhythm problem becomes extremely important in those situations. So yes, it can cause heart failure. Heart arrhythmias can, especially atrial fibrillation, are very well known to cause stroke, and many times patients may present to the hospital with an unfortunate event like a stroke, and that's the first time they are found to have atrial fibrillation, because they never felt any heart rhythm problems or any symptoms in terms of cardiac symptoms, but they just landed up in the hospital with a minor or massive stroke, which is quite unfortunate. And that is why it is so essential, especially for us, to screen for atrial fibrillation in patients who have any symptoms suggestive of that, so that we can decide whether these patients need to be placed on blood thinners. And if they were on blood thinners, they would not. We would have prevented them from having a stroke in many situations. So that is why screening for certain heart rhythm problems like atrial fibrillation is extremely important, considering how common they are.
Okay, thank you. We have a question from Cindy. What kind of downtime should a patient expect after an outpatient procedure for PSVT? I don't know what. Can you tell our viewers what that is? I don't know.
PSVT stands for paroxysmal supraventricular tachycardia. We were talking about SVTs. That's essentially what she's talking about. SVTs are again a category of tachyarrhythmias, or rapid heart rhythm problems, that are coming from the top chambers of the heart, essentially due to a firing focus, abnormal firing spot in the muscle of the top chamber, or due to a short circuit in the electrical wiring of the heart, which is causing this rhythm problem. So they are very common heart rhythm problems, and we do a lot of ablation procedures for SVTs, and we often resort to ablation before medications in these patients, or even when the patients are on medications, because ablations are often curative in 95% of the cases. So what she is asking is, what is the downtime for such ablation procedures? So if we are doing an ablation procedure for SVT, usually if I do the procedure before noon in the case, I would send them home the same day. So most of my SVT ablations would end up going home the same day, and I think that is true for many, if not most, hospitals in the country. It's essentially true for the place where I trained at, and same at MedStar Heart and Vascular Institute. That's what we are doing. Most of our patients with SVT are able to go home the same evening. They just have to make sure for 48 hours they do not do any heavy exertion or climbing up and down the stairs or repetitively or trying to move their legs rigorously for any reason. And I think overall they can go back to work as long as they are not doing heavy strenuous work in about 72 hours or so.
Great, thank you. And thank you for your question, Cindy. Another question for you, are there lifestyle changes that need to be made when you're living with an arrhythmia?
When you are living with an arrhythmia, yes, there are, and that's a great question because it depends upon the type of arrhythmia, what type of lifestyle changes have to be made. In cases of SVTs, which we were talking about, often an arrhythmia is triggered by certain triggers, and those triggers are very specific to that particular patient. Some patients have an arrhythmia when they're standing out in the heat. When some patients have it when they're drinking extremely cold water. Some patients have it when they drink alcohol. Especially binge drinking is associated with these arrhythmias, especially atrial fibrillation. And exercise, on the other hand, strenuous exercise has been shown to induce ventricular arrhythmias in certain patients, certain group of patients, such as ventricular tachycardia. And so, depending upon the type of arrhythmia, I would recommend the patient to sort of cut down on exercise or just restrict it to a particular level, not go beyond into a marathon runner or being a marathon runner or something like that in some arrhythmias. On the other hand, I would try to figure out what is the trigger of the arrhythmia, of the specific arrhythmia that the patient is having, and then suggest accordingly what needs to be done for that particular patient, as we talked about last triggers.
Okay, great, thank you. So that's all the questions we have for you right now. We hope you learned something today about diagnosing an arrhythmia. If you would like to make an appointment with Dr. Saini, please call 410-554-6727. Thank you so much for joining us today. I appreciate it.
Thank you very much for having me.